they're not putting the addiction above the baby. They're mothers. They're not bad people. And we need to love them as mothers and as women that are just doing important things. And women are strong.
Yes.
And we're built to be strong. Women are sometimes expected to be everything, and especially mothers. We have women call, and it might not be this week.
Yes.
And it might not be next week. But we keep calling them, and we keep texting them, and we keep offering them, and we keep loving them. And we just hope that we can love them to a place where they can love themselves.
Substance use disorder touches all our lives, and often we feel hopeless or frustrated in our pursuit to understand how and why it happens.
Welcome to APC Recovery Cafe, where we discuss the topics and trends around substance use, provide education and resources, offer recovery support, and also discuss prevention tactics, all through the stories of the people who have been there.
We invite you to grab your favorite coffee or tea and join us for a variety of guests that will bring understanding, information, connection, and hope.
Together, we can break the stigma and pave a brighter future for each other.
Hi folks, welcome into this episode of the APC Recovery Cafe. My name is Art Wimberly. I'm a person grateful to be in long-term recovery, a volunteer at the Addiction Prevention Coalition. And in the studio today, we have our co-host, Carrie Wimberly. Good morning, Carrie.
Good morning, Art.
Hey.
Glad to be here.
And would you like to introduce our guest today?
I would. I'm excited to introduce Suzanne Muir. And I'm going to read this so I don't get this wrong. Suzanne is a friend and a partner of APC, but she is the Associate Director of the Department of Psychiatry and Neurobiology, at UAB. But our work with her has been around her role in the substance use programs, and also something that I really want you to talk about today, and that is the comprehensive addiction and pregnancy program.
Yes.
Which
CAPP, which is easier to say.
Which is fairly new.
The first patient in 2018.
Okay. And really excited to share that with folks. But before we get started, I want you, where's your beverage? Okay. So tell us what this is, because
this is a chai latte. An iced chai latte, because at home I burn them. So I switched over to ice because I can't ruin this. And then light ice because I drink them slow to savor them, and the ice melts and dilutes the flavor.
Okay.
I like this drink because it reminds me of Christmas.
Oh,
because it's got like cinnamony, cardamom-y flavors to it, and it just makes me feel like holiday.
I have never had anything chai. Are you a chai?
It's become very trendy. I almost switched because it became too trendy, but I held on to it because I'm a legacy chai drinker. So all those people out there that are drinking it for the first time and bringing it down.
You've been doing that for a while.
I've been doing it for a while.
So it's not seasonal. They have the chai.
No, they have it all the time. Not to be confused with matcha, which is
different.
Horrid.
I'll remember that.
Yeah.
So stick with the chai.
Stick with chai.
Tell us what you think.
Yeah. I have strong opinions of matcha.
Well, we're glad that you had the time and availability to come up early this morning and be with us. And so I know Carrie's wanting to get into some specifics, but tell us a little bit about how you even got into the field you're in. What's the backstory there?
I think I kind of fell into it, honestly. So I have a master's degree in social work, and I actually went to college to be an English major. I wanted to be a journalist. And then sometime in college, I got a gig working as a residential counselor at a camp during the summer. And we had kids from inner city, Birmingham. We had kids at certain weeks, kids had cancer. Other weeks, kids had cystic fibrosis. And it just rocked my world. Wow. And I went back to school and I declared a major in social work.
Wow.
So was there something that touched you about the fact that these were subsets of population that wneeded resources, were struggling in terms of health or issues that were going to limit them if they didn't get resources? What touched you about
I don't know,
that?
they were so spongy. You know, they were so open to experiences. And I'll never forget a week I had a group. My group that was assigned to me was 17 6-year-old little boys from public housing communities.
Wow.
And it was the best week ever. They would try everything, and everything was exciting to them, and they were very adventurous and open. And I just had so much fun, and they taught me so much, and they just poured into me, and it was like, wow, I could do this as a job. That's really cool.
So what's your undergraduate in?
Social work.
Oh, okay. And then
Yeah, at Auburn, the social work department was really small at the time. That was like long ago. Yeah, it was social work. And then I went straight through to get my master's degree because I learned in several clinical like practicums that I didn't want to be like a clinician. Like,
Okay. You really actually wanted to be able to be in contact with the folks you were trying to help rather than just be a data gatherer or
no, I wanted to be a planner.
Yeah.
I honestly wanted to be a community organizer. Like one-on-one, if I have too much one-on-one, I take it on too
Okay.
heavy.
Yeah.
And some of it has to distance my personality.
Yeah.
I wanted to do more macro stuff.
Okay.
So I went straight through to graduate school and had a great experience at Florida State. Had some great professors that were like old school community organizers. And I kind of found my calling.
How'd you get to UAB?
So I was raised in Shelby County. I had to do my final internship. When I was at Florida State, I was a student assistant, a graduate assistant. That paid most of my way, gave me in-state tuition. When I did my internship, that went away. And so I came home to do my internship. And I did it at United Way and had a fantastic time. And then I went into fundraising and realized something else that I wasn't good at. And then from there, actually, I worked at the Jefferson County Housing Authority for 7 years.
Oh,
and
wow.
Did resident programming there for kids.
I did not know that.
And families. Yeah, I spent 7 years there.
So how was that experience?
It was really, really cool. We got to start some boys and girls clubs in different communities. Jefferson County Housing Authority has lots of more rural. I mean, I don't know if the USDA would count them rural, but
Yeah.
in Jefferson County, you have to be going there to get there. So the kids didn't have a lot of resources. The families didn't have a lot right there. So I was able to start a bunch of stuff, and that was really cool because it was kind of like camp days, you know, where
Yeah.
I would spend my summers sitting on the floor with the kids and trying different things and networking with different community agencies to bring them to the kids.
Wow.
I really, really enjoyed that.
Sounds like a great blend of the personal, but also kind of that community planner type
Yeah.
thing.
Yeah.
You're doing
Yeah.
bigger picture stuff.
Yeah.
Yeah.
Yeah, and the communities, their communities are fairly small, so you walk around and gather the kids, you know, from there. You're like, hey, I know you're in there. We're doing this at the center. Come on down. I know you'll like it. So I was there for 7 years, and then I met a few people, and they told me about a job at UAB, and I interviewed for it, and I got it, and that started me in substance use and addiction, and that was obviously the right place for me because it's like my biggest passion, and I can't imagine doing anything else.
Wow. So the development of the two major programs that you're in, one of them you said started in 18.
Mm-hmm.
Okay. What about the other one? What is most of your time spent in the substance abuse? What's that about?
See, now I've actually been at UAB. I've been in the same division for 25 years,
Wow.
actually, this month. So I've done different things. Right now, most of my time is we serve kids that are court involved,
Okay.
that are using. We have the pregnancy program. We have family wellness, which serves parents that are child welfare involved or at risk of being child welfare involved because of substance use. And then I think what I'm doing the most now is we've expanded some of the resources to Walker County.
Okay.
And I get to do, go out and meet people and connect the dots, and that's what I'm doing now.
I did not
mostly.
know that
And
either.
that I love that.
That is so cool.
Yeah, I like starting things.
You're a starter.
There's other people that can keep stuff going better than me. But I'm really good at starting stuff. I like it. I like the excitement. I like
Figuring
being
out
it-
all the pieces.
figuring it out, like
Yeah.
the analytical kinds of pieces, and
We kind of we line up a lot.
we do. I think we're the same Enneagram.
I think are you
Oh,
one?
I'm a 1.
Yeah.
That's why my back hurts. But yeah.
Yeah. I was going to say, there's actually, believe it or not, some evidence-based data now somatically about types, and ones tend to be on that spectrum where a lot of muscle tightness.
Oh my gosh.
Yeah.
And my massage therapist was like, "How do you walk
function.
around every day?"
Yes.
Yeah.
I don't know. If I relax, I'll just fall apart. Get like fetal position.
Yeah.
Feel that way too, Suzanne.
Yeah.
Yeah.
We probably need to
Yeah.
have lunch more often.
So one of the probably the point of intersection that we got to know each other was students. So talk a little bit about the struggle of that age group working with substance use treatment, because I know that's something, we're trying to work on prevention, but we're also trying to work on intervention, and it's such a hard time
Yeah.
for adolescents that find themselves in this situation when most of their peers are just approaching the age where they can legally drink or whatever, trying to actually work and say, this is a problem. This is something that you're going to have to choose to step away from.
Yeah.
Can you talk anything
Sure,
about that?
sure.
Yeah.
Well, our team's at family court, so our kids are all court involved.
Okay.
So something happened. Lots of different reasons to be court involved.
Right.
So their probation officer has detected some kind of substance use, whether it's a history or whether they admitted to it or whether they just drug tested positive.
Right.
So that's when we get involved, and we try to get them connected to services, find out what they're doing, how often they're doing it. It's hard being a teenager. I mean, it always
Period.
has, and I think it's harder now.
Yeah.
Actually, I know it's harder now. And our kids, the majority of them are boys, and then you got overlaying the majority of the boys are African American. They've got a lot going on.
Yes.
And substance use isn't always the primary thing
Right.
that's going on. Sometimes it's how they get through all the other stuff.
Yes.
A lot of trauma involved. you think?
Yeah, a lot of trauma, a lot of community stuff. I mean, we hear about the violence in the communities. I know we do, but I mean, it's just one thing to hear about it on AL.com. It's another thing to be living in it.
Yeah. And when we talk about prevention, we're always looking at the risk factors. Genetic, environment, and individual, and they're probably dealing with all of those.
Yeah. Oh, yeah. Yeah. And so, I mean, this sounds kind of callous, but I mean, sometimes you can't blame them for using substances. I don't know if I could do any better. In fact, I know I couldn't do any better.
Yeah.
So a lot of our kids use marijuana and alcohol. We've recently had some kids that have done more polysubstance, and I
Yeah.
think some of that's the fentanyl popping up and stuff
Yes.
that it wasn't before.
Right.
So, yeah, they're just trying to survive.
Yeah.
What are some of the things y'all do with them? Do you have support groups? Do you have counseling? How do you interact?
Yeah,
with
so we work with probation because probation's pretty much their case manager, if you can use that term. So we just layer services with them. So we get them connected if they need a substance use assessment. We get connected to groups and individual if they need that. We coordinate with mental health because a lot of the kids have co-occurring mental health
anxiety,
stuff,
depression,
anxiety, a lot of attention deficit kinds of stuff.
Yeah.
School stuff. I think we just serve as a member of the team that tries to address all those pivotal areas. We've tried to do family groups in the past, not really successful. I think families just have so much going on. You just layer another thing on top of it, maybe.
Yeah. Carrie and I are fairly experienced because of our own family system and have done family support groups for probably 20 years now. And even in what you might want to say is a more stable population, it's really difficult to get folks to commit to that type of work.
Yeah.
It's hard, and they're busy, and their energy is focused on the loved one that's really struggling.
Yeah. Well, and you think about when you're in the point of crisis, especially when it's chronic, you just give so much energy just to whatever is going on that it's just hard to give more to something else that somebody has decided that you need.
Yes.
We always say if we can get them to come to one.
Yeah.
Yeah. And you feel that peer support of knowing there's so much comfort in knowing that you're not doing it by yourself, that it's not just your family.
You're not alone.
That
you're not the only one.
You're not the only one.
Yeah, we talk about that, in those groups, we're all, word of mouth is the best way to get people there. A friend saying, hey, we've heard about this, or I go to this, come with me. But you see, when they walk in the room, you see that anxiety, and we know it, we've experienced it, but then, they sit down, and just when we go around the room and just do introductions about, who we are and who we're here for, who we love, and what their struggle has been, up until this point, you see, I always say their shoulders drop, because, in many ways, they probably have not been in a room like this ever before. And there is a sense of shame and guilt as a parent, especially, that we felt, where it's like, oh my gosh, this is my fault, because clearly there was some parenting issue that they're not able to function, out in the world. And so it's sad, but it's also a beautiful thing to see that community, happening just like it does in the circles and the rooms. It happens with families, if we can get them to come, and then it doesn't feel like a burden.
Right.
It feels like a blessing.
Well, and we've seen in the field, so much value in integrating people with lived experience as part of our team. And we all recognize how important that is to our clients or our patients or individuals, whatever you want to name them. But I think we have work to do to get that same lived experience with the families and loved ones and people in their lives. That seems to be harder, but I guess it'll just take time.
Yeah, I think it's coming.
Yeah,
I think we're getting there.
I do too.
Well, I do think it's part of the conversation to reduce the stigma around all the facets of substance use disorder, and this may be one of the last stigmas to kind of be pushed away.
Oh, it's just so overwhelming, the stigma. There's so much work, and it just feels like you whittle and you whittle and you whittle. And so you're right, maybe that'll be the last piece, and it'd be great to still be practicing or at least still be breathing when some of that's been relieved, but it's just thick.
So talk a little bit more about CAPP.
Talking about CAPP. So CAPP is a integrated prenatal care and substance use clinic at UAB.
So the women that come are pregnant and struggling with some level of substance use disorder.
Yes.
Okay.
Yes, and that's all that comes to the clinic.
Okay.
So when you have clinic on Tuesdays, everybody there is on a journey. Okay. It's a place where you can be yourself. You don't have to hide stuff. You can talk openly. Our staff is passionate about it. So it's a place that's welcoming and non-judgmental, and you can just be you. So it's just really exciting. It just makes so much common sense. So women self-report. We universally screen. We at UAB, we ask everyone that comes in for prenatal care about substance use. It's up to them whether they want to disclose.
Yeah.
We don't do drug testing. It's up to them. So these women have identified, which makes them brave
Yes.
and
Yes.
strong.
Yeah.
And then they come together on Tuesdays. We do group prenatal care, which means we use the group model, and they're grouped according to when they're going to deliver, so they get to travel their pregnancy
Together. Oh, yeah.
And we do prenatal education, but we also the group is facilitated by a nurse, but also somebody with lived experience.
Okay.
So it's a time for them to talk about fears and concerns and what's going on with them in their recovery, but also to get information about what's going on in their body and what's going to happen at the next step.
Wow.
So we do medications for opioid use disorder there. We have a case manager that will go to court with them if they have hearings. We Alethea House and Olivia's House, which are the residential programs, just van load the women over.
Yeah.
So we get to coordinate with some great partners in Birmingham. We also integrate them into an outpatient group if they need that level of treatment. And the outpatient group is just women, and it's all women that are child welfare involved or at risk of. So it's another peer group that's positive and supportive. And we just try to bring everything to them, and then we follow them as long as they'll have us after delivery.
Do you ever have you ever had a graduate, so to speak, come back and be involved in some way in the program to speak or to share?
We've had graduates record videos for us as promotional stuff, and we hear from them. And then we've had women that will come back to us because we've been going for a minute. We've had women come back with their second baby.
Okay.
We get to see them again.
Wow.
So it's just a safe space, no matter where you are in your recovery. It's a good place. It get a lot of referrals. The sad part, but it's an exciting program, and I'm happy to be a part of it. And last year, we got funding from the Department of Mental Health to take the services to Walker County.
Okay.
And so that's what we're working on now. The model looks a little different in Walker County. We've partnered with Walker Women's Specialists, which is the OBs that do most of the women with Medicaid, and Fellowship House. And we're actually, when women come in for treatment, for prenatal care, they actually get treatment. So while they're there, they do an outpatient group and get some peer support. Walker County has transportation issues like every rural county. Right. So when they come to the doctor, we try to take advantage of it.
Yeah, do as much as you can.
While
you have them.
Yeah. While we have them.
Yeah.
So they don't have to come back as often.
Yeah.
So it's been fun.
Would you say, and you may have to just make an estimate of this if you can't even do that, more recently through the pandemic, would you say there's been more of an increase in folks, the women that are pregnant but are also struggling with substance disorder? Has it stayed about the same? Is it getting better? Do you even know? Did the pandemic affect it in any way?
Yeah,
like it did?
I'm not sure, Art.
Yeah.
I can't say.
That's correct.
When you look at data and research that we use when we speak, it's not that recent. We've had an influx of referrals, but I don't know if that's because of the word's gotten out more.
Yeah.
So I can't attribute it to the pandemic.
Yeah.
Data's always behind.
Yes.
Right.
So we won't know the effect of the data or the effect of the pandemic on the data for another few years, unfortunately.
Okay. Yeah.
Well, it seems like Walker County, I know Recovery Resource Center is there too. So it seems like
we partner with them.
Things are expanding.
I think
there,
so.
Which is really exciting.
So we're doing out there in Walker County, we're doing the services for pregnant women.
Yep.
We're also doing their first gender-specific outpatient group.
Okay.
And both programs are using a curriculum called Helping Women Recover, which is all trauma-based, and it talks about what happened to you.
Actually, I've heard of that.
Yeah,
Yes.
it's really cool, and they do grounding techniques, they do meditation. It's very centering, so we've had good results with that. And then the third part is just community outreach, and we're partnering with all the other providers that work with this population, and we have a tagline called She Recovers.
I saw that.
Yeah.
Yes.
We've got yard signs all over the county.
Love that.
We've got T-shirts, we've got swag. And so we're trying to work together to try to get women into prenatal care earlier and also into treatment. So we're trying to partner with folks and get the word out. We've expanded to Winston County because Winston comes to Walker because it's the birthing hospital.
Right.
So we've kind of gone beyond Walker into some surrounding areas and just trying to get the word out to provide a safe place for women.
And then is it part of the Healing Network?
Mm-hmm. It is. We're a working group under the Healing Network.
Oh my gosh, I'm such a fan. I'm a fangirl of the Healing Network
me too.
because of the way that they have they took the time, to and I don't know, you probably don't even know, but the Healing Network is really, and I think it was funded through the Community Foundation.
It was.
And spearheaded an effort to take an interview, to look around at all the resources, all the nonprofits, all the for-profits, all the organizations that are working in this space, really understand what each one of them is doing, then look at the whole, addictive cycle, and recovery and sober living, the whole thing, and then find the spaces, the gaps that are not being met. But the cool thing that they do is once they find those gaps, they look at all the organizations that could meet that and then help them get the funding to fill the gap.
Wow. Wasn't that the organization that helped APC 2 years ago when we needed it because of the pandemic? Instead of doing the things in person that year, didn't they help us?
Series.
Yeah, connect the Journey series.
Yes. And they did the
Walker
whole
County.
thing.
Yes. Okay, that makes sense.
That was video based, webinar based.
Yeah.
And I think it's working beautifully.
Yeah, it's very organic.
Yeah.
Yes.
Well, Suzanne, you mentioned a minute ago trauma.
Mm-hmm.
And it seems to me that I'm hearing more and more in the different spaces now that whether it's prevention or recovery, where it's medical or it's recovery groups or helpers, we're hearing more and more, I think, about the validity of trauma and its role in substance use disorder. Can you talk a little bit more? Are we actually getting wiser about the fact of what the role plays? It seems to be being addressed more.
Yeah, we're talking about it more. It's always been there,
right?
But we've named it.
Yes.
And that's always the first step.
Yeah.
Yeah, I think we're acknowledging it more, and we're asking the questions to find out.
Yeah.
To delve a little deeper into it, and making safe spaces where people can actually talk about it.
I've even seen it more from what I would call the more traditional conservative organizations that play a role. That they seem to be talking about it more as something that's really important to look into, whereas before I think sometimes they discounted that role.
Yeah.
Yeah.
Yeah. I've seen that too.
Yeah.
Yeah, I think it's become more mainstream to talk about it and to acknowledge it.
Yeah.
It doesn't seem to be unpopular with any specific group. It just seems to be the way we do business now.
Well, some of it seems to have to do with some of the advances in terms of medicine and biology and neurobiology, about how much the idea that the body keeps the score, and how we were just now catching up to the fact that, yes, a lot of this is stored as trauma in the body, and it impacts mental health and substance use disorder greatly. Yeah. So it sounds like a positive thing that.
Oh, yeah, definitely.
Yeah.
It's a positive thing.
All right. So anything on the horizon? Anything new? Anything
on the horizon?
Fresh? Where are we headed? Where do we want to go?
I want to do CAPP everywhere, honestly.
So is that what's the? I mean, how much is that done around the state, around the country? I mean, yeah, you guys know.
I think it's done probably more so other places.
We're behind again.
We're a little behind, but we're not behind in every aspect. I like to bring that up. I mean, but with this, we might be a little behind, but the model is just integrated care. It's just so commonsensical. But research supports it, and it's just the way to have healthy moms and babies,
And in the past, shame and guilt and shame has pushed them to the side to not even seek the resources because of the shame factor. Yeah.
Yeah. In Alabama, they're more scared because there's a fear of prosecution.
Okay.
So why should I tell you I use substances when you're just going to put me in jail for it? It depends on where you live, and what the law enforcement and district attorney does in that community. But, there's a fear.
Yeah.
So it's better to stay in the shadows. It doesn't, we try to talk to the women, it's like, okay, do this early. Let's get a plan. Let's have some control over what happens. But, it's scary.
It is scary.
I mean, it's scary enough being pregnant.
Yes.
Without being an active addiction, and then whatever's going on with you in your environment. We always say that with our women that deliver. Goodness gracious, postpartum is heinous for a lot of people.
Yeah.
And then you have early recovery, and then you have a baby that might be not the easiest baby because of the exposure.
Yeah.
So it's a lot. We're doing really good at keeping families together.
That's great.
With CAPP.
Yeah.
And we just got to find a way to support them so they can stay together.
Yeah. Okay, so thinking about our friends, our daughters that might be struggling with substance use and being pregnant. What are the things? Can you give me anything for people that are watching or listening, if they might be concerned about somebody? What are the things that they could look for, and how might they have that conversation to let them know there are some resources? Do you have any advice?
I listen, look for the cues. Don't be reluctant to ask questions. Unconditionally love and support, perhaps not supporting or, condoning what they're doing.
The use,
the use, but staying in the conversation.
Yes.
There are resources out there to help.
Right.
There are people that really want to help.
Yes.
And not judge.
Right.
But help them be a healthy mom.
Yep.
Recognizing that they are a mom when they're pregnant.
Yes.
That their role is important. That they're not putting the addiction above the baby.
Right.
They're not bad people.
Right.
They're mothers.
Yes.
And we need to love them as mothers and as women that are just doing important things.
Yeah.
And recognize that. And so there's people out there that can help and walk alongside and help you be healthier.
Yes.
And help your baby be healthier.
Yeah.
And help address whatever's going on with you.
It's probably complex.
Oh
my
gosh.
It's probably not just substance use.
Yeah. And women are strong.
Yes.
And we're built to be strong.
Yes, and they want to do this, and they want to do it well.
And it's okay to say, I can't do it alone.
Yes.
And actually, that makes you stronger.
Yeah.
Because it's just admitting that you're not everything.
Yes.
And women are sometimes expected to be everything, and especially mothers.
Yep. Asking for help is hard.
Asking for help's hard.
Yep.
But you just got to stay at it. It might not be, we have women call, and it might not be this week.
Yes.
And it might not be next week. But we keep calling them.
Yeah.
And we keep texting them, and we keep offering them.
Yeah.
And we keep loving them.
Yes.
And we just hope that we can love them to a place where they can love themselves.
Yeah, that's beautiful. Thank you.
But
So what would you say to someone who's watching or listening in terms of how could they help? Okay. What would you want them to know? Is there an email? Is there a phone number? If somebody really wanted to get involved or help or support or just get more information to help y'all advance your programs, what's the way they could get in touch? Or
yeah, informally, probably just call me or shoot me an email. It's probably the best way. I mean, we don't have any formal stuff.
Okay.
We work with lots of partners. We don't have any formal like nonprofit that's dedicated to it. We have a lot of stakeholders in the community that work for different entities that want to do this. You know, they there's no shortage of people that have big hearts in Alabama.
Yeah.
And there's no shortage of people that are willing to do the work and are doing the work. So yeah, they can just call me, and if I'm not the right person, I definitely can plug them into who it is.
Okay, so give us an email that they can use.
An email. The shortest email is smuir, M-U-I-R, at uab.edu.
Okay, great.
That's the shortest one.
Okay, and so what if somebody's listening to this and they are either pregnant and struggling, or they know somebody who is? What's the referral point? What's the point that they can find out about CAPP?
You know, and I don't have the phone number for our peer.
We can add that later.
Yeah.
Yeah, if you don't mind.
Yeah.
Yeah.
I have women calling me. I've got, jails calling me.
Okay.
But Leslie's the bomb. She's our
Oh,
peer.
Leslie's the one.
Yeah,
I know Leslie.
Leslie Moon. We
Need
need
to
to
get her on
we need to
here.
give people her phone number.
Yeah.
Okay.
Because she's a really good point of first contact.
Okay. We'll add that
Because
later.
she's been there.
Yep. Well, thank you so much for coming today.
Sure. Thanks for having me.
And joining us in this conversation. We really are trying to do several things. We're talking to people in recovery to let them tell their stories, provide hope, but we also love talking to our friends and our partners, and we appreciate you guys being that for us, for APC, and letting people talk about what they do. Because I think, especially like something like CAPP, there's a lot of people out there that don't even know that exists, So we're trying to have these conversations to help get the word out so that people know about the good work that you guys are doing.
Thank you.
Yep.
I appreciate it.
Yeah.
Well, folks, thanks for joining us for this episode of APC Recovery Cafe. Join us next time when one of your neighbors will share what they're doing in the prevention and recovery and health field. Thanks.
One of the things that APC is known for is being a connector, because we're stronger together.
Not only are we there for those who are suffering through substance use disorder, but we're there for family members, and we really take our job seriously.
We all have personal reason why we're in this field. We're changing people's lives one community at a time.